the potential implications for the presidential election of the Supreme Court's consideration of the Affordable Care Act,
what Americans think the High Court should do,
and the most fascinating finding of the week. I'm Frank Newport, Gallup Editor-in-Chief.
I'm Susan Page, Washington Bureau Chief for USA Today.
And this is Election Matters. Well, Susan, there's no question the big news event of the week is down the street from us at the Supreme Court, 3 days, right, of review of the constitutionality of the Patient Protection and Affordable Care Act. It's got to have some implications for the election. Our show is Election Matters, so the real question is, whatever happens, it's going to have an implication one way or the other. First of all, what happens if the Supreme Court supports the act, says it is constitutional, it doesn't overturn it? That's got to be good for Obama.
You know, I think that would be, the White House would see that as great news politically. For one thing, President Obama, who of course taught constitutional law at a law school, his argument that it's constitutional would be reinforced. And also, we know from our polling that more than 7 in 10 Americans believe that the act is unconstitutional. So for those voters, some of whom are maybe reluctant or suspicious of the law, it could be reassuring for them as well.
Absolutely. Could it, however, energize the Republican base? There's always another side. So one argument would be if the Supreme Court supports it, Republicans could use that as a get-out-the-vote mechanism. So now we have to politically overturn it since we can't judicially overturn it.
Right. It would mean that if you want the law repealed, you've got to do it through the White House and Congress. You're not able to do it through the courts. In that way, it might energize Republicans, but it also could force Republican presidential candidates to alter the case they make against the law, because all of them now argue that the individual mandate in the health care law is unconstitutional. They would no longer be able to make that argument, presumably, if this rather conservative Supreme Court says it is constitutional.
What happens if this rather conservative Supreme Court knocks down all or part of it? That's got to be bad for the Obama chances of being reelected, I would assume.
Katie bar the door then, right? Because we've had this law in effect for 2 years, and if it's just all thrown up in the air, that would have consequences, I think, for both sides. It would mean that the White House has been pushing a law that the court says is unconstitutional. But, you know, it might also mean, if you take the reverse, the glass half full, maybe it means that Republicans don't have to vote out all the Democrats and the president to overturn the law. The court's going to do it for them. I don't know if that might have some effect as well.
So we're basically saying we don't know what the implications, right? It could go either way no matter what happens, and it's going to be this summer when the decision is announced.
You know, I would be more inclined to say it's good for the White House, the administration, and Democrats if it's upheld. Yeah. And bad for them if it's struck down. But there are always cross currents in politics, so you don't want to say anything is all one way or the other.
Absolutely. Now, attitudes towards the law, we've surveyed it. USA Today Gallup poll, lots of people have surveyed it. Our last survey, national adults found it was about even in terms of a good thing, bad thing that the law was passed. Other polls, there was a new poll out this week for the New York Times CBS showing an 11-point negative. That is, I think 47% disapproved and 36% approved. And when I look over all the polling, there's not been a single poll that I can find that shows a majority, 50% or more, that support the law. So clearly Obama has not, with the American public, made the case overwhelmingly that this law was a great thing, that it was passed.
All right, and at the time the law was signed, people at the White House argued that once people knew more about it, they'd like it more. Once more popular provisions of the law went into effect, like the ability to keep young adult children on parents' health insurance plans for a while after they get out of college, that would convince people that the law is a good thing to do. That has not happened. But Frank, you've lived your life looking at polls and studying them. Why the disparity, do you think, in polls between, for instance, our poll that shows about an even divide and the New York Times poll that's just out today?
Yeah, well, of course, there's a time difference. Our last poll on this was in February, and this poll that came out of the New York Times was later in March. But I looked through all of the polling, and really they're in two camps. A number of polls, like our USA Today Gallup poll, show it breaking even, but there have been several polls that do show a significant deficit where people are more negative. I looked at the wording. Usually there's the way it's phrased, but I can't find a consistent theme in here, so I don't have an answer to that question. It just looks like when you poll on this question, you either get Americans roughly split or you get more negative than positive. However, we don't find any polling. I guess that's the key point, where you have a significant majority, an 11-point majority in favor of the poll that we can find.
So none of the polls are really good for the administration on this front.
That's what the data would show so far. Now, you mentioned implications. We track things with our Gallup Healthways data, everyday health in the U.S., and one of the questions we ask is insurance. We have found over the years since 2008 a continual decrease, or I should say an increase to look at the other way, in the percent of Americans who are uninsured. So in this broad sense, no impact yet on the percent of Americans who are uninsured in the big picture sense.
Now, the White House would argue that the provisions that expand coverage haven't gone into effect yet. That'd be the expansion of Medicaid to cover more poor people, and also the individual mandate that requires people to either buy insurance, have insurance, or pay a fine. Now, of course, the reason they haven't gotten into effect is because those are expensive elements, the controversial elements, so they put off having them go into effect until 2014.
But there has been one change, which the White House obviously looks on positively. In our Gallup data, we have seen an actual decrease in the percent of 18 to 25-year-olds who are uninsured. In fact, it's anomalous because almost every other group except for the quite wealthy have shown this increase in uninsured, but this young 18 to 25 group has dropped. So it does look like that one provision of the law may have had some impact, that provision being that young people can ride on their parents' policies.
Right, which one of my kids was doing until this month.
Aha, off your policy now?
Off my policy
Yeah.
now.
So at least they can say there's been this one impact. But we can't, I think it's too early to say, and they would agree with the same thing, to see what the overall implications are.
You know, one other thing to look at when we talk about attitudes toward the law, we continue to find intensity of opposition, not of support. So while people are divided, people who are against it feel much more strongly impassioned against it than the people who support it.
And overall, which I think is an interesting finding, this opposition to it exists even though when you test some of the individual components of it, Americans favor it. And I think that's probably due to the fact that in general, it taps into that big American concern about big government, particularly on the right side of the spectrum. So it's not the trees, it's the forest. The forest is, here's a major part of American life that the government is going to take more charge of, and I think that's where you get some resistance based on our data. Americans, think very, very poorly at this point of the federal government.
And one last thing, talking about political impact, you can tell the White House does not think this is a good issue for them because the president doesn't talk about it. It's the Secretary of Health and Human Services who does all the events trying to sell the law as being a good thing. And on the second anniversary of the law signing, the White House did nothing to mark it involving the president.
Most fascinating finding of the week is from our healthcare data with our Healthways Index. We find that people who are insured have healthier behaviors than those who don't. So in other words, it's a good thing to have health insurance above and beyond the fact that you obviously can pay for your health care. And that's controlling for a lot of demographics.
So it's not just that you're likely to be richer or healthy, start out being healthier if you have health insurance.
Yeah, for some reason, people with health insurance controlling for all the demographics in the world that we could control for are less likely to smoke, more likely to eat vegetables, and at least a little more likely to exercise. So something about having health insurance operates positively on the whole gestalt of the human being. How's that?
Maybe people are listening to their doctors.
It may be. If you have health insurance, you're in more contact with the physician and therefore are less likely to do these bad healthy behaviors. Well, Susan, we'll be back next week. No primaries this week. Have a week off, but of course the big primary next week, it's in Maryland and D.C., but the big one's going to be Wisconsin, so we can talk about that next week. You'll be in Wisconsin.
I'll be in Wisconsin this week, but back next week for election matters.
We'll get a first-hand report of what the Badgers.
The Badgers, yes, the
thinking
Cheeseheads.
and feeling.
Yes.
Up in Wisconsin. I'm Frank Newport, Gallup Editor-in-Chief.
I'm Susan Page, Washington Bureau Chief for USA Today.
And this is Election Matters.